Good morning, everyone. Today is Thursday, July 13th. Thank you so much for joining into our healthcare reform webinars. These are weekly webinars that you can come to and hopefully get your questions answered and learn the latest and greatest in health insurance reform. My name is Deb Wilkinson, and I'm the Vice President of the Health Plan Options Department here at URL. I oversee the group health markets as well as what is left of the Pennsylvania individual under 65 market. A lot of what we talk about, might have some consistencies within the Medicare offerings. However, this webinar is really specific to the under 65. So I just want to make sure that everyone understands that, so there's no confusion, even more confusion that is out there already. If you're new to this format, you can ask questions in two different ways. You can raise your hand icon on the control panel to the right of your screen, or you can type in your question and I'll answer that at the end of the webinar. So just with a show of hands, if you can hear me okay and see my screen and the PowerPoint, just put your hands up and let me know. All right, excellent, perfect. So let's jump right into it. As we've started this year with the new administration, we have a separate segment to talk about all the happenings, because let me tell you, as I've mentioned, things happen and change so quickly. It's very hard even trying to keep up with it and create a PowerPoint every week, because I change it constantly up until the morning of the webinar. So, again, I am trying to keep you as informed as possible. Specific to the Pennsylvania legislation, we had talked about Mario Scavello's House bill that he's introducing to amend Act 147, which would allow agents to charge a consultation fee when commissions are not paid on the individual under 65 market. It has not been introduced yet. It's still gaining some sponsorship. So I'm not sure what the timeline of that is, but again, we'll keep watching that so that you are as informed as you possibly can be. PAHU, the Pennsylvania Association of Health Underwriters, is looking for some participants that are interested in working on their legislative committee. Of course, this is a way to stay informed, but it's also a way to, again, support your industry and hopefully make the changes on the local level as well as the national level that certainly can benefit all of us. So if you have any interest in becoming part of the PAHU Legislative Committee, just let me know and I'll get you the contact information for the person that you should reach out to. So let's talk about the Better Care Reconciliation Act, better known as the Senate bill. As we may all know, the administration held a lunch meeting on Tuesday with the GOP Senate and tried to really get to the bottom of how they can get this bill through. We have heard a little bit leaking out of what has been not what's been added, but what has not made the cut, what the sticking points are. It seems as Medicaid is a real sticking point for even the conservative GOP members. Their constituents are worried about what the changes in Medicaid may or may not do for pre-existing, for funding, for everything. So that seems to be the sticking point from the information that I'm reading. What I have heard of what has been added is that they decided that they wanted to keep in some of the Medicare taxes, and the Medicare taxes that they're considering adding back in are the investment tax of the 3.8% for investments for folks that are single making over $200,000 and above a year, or families making $250,000 and above a year. So it looks like the BCRA is adding that back in, as well as the Medicare wage surtax of 0.9%. Estimates are that brings in $231 billion with a B in tax revenue over the next decade. So that's kind of interesting. That's what they are, considering bringing in. They also added more money to, the opioid epidemic fund. This is obviously very important as a nation because it is a big concern for, for most of us. So they added more money to deal with the opioid addiction. And then one of the things that I've heard, which is kind of really interesting, is allowing health savings account, money within your HSAs to pay for premiums. Now that's really odd considering that, even back to the Archer MSAs, that was never allowed. So that should be pretty interesting. But if you recall, we've talked about this employer exclusion that's also gaining some steam, which would really cap what an employer could, deduct as group health insurance, and then pre-tax deductions for health insurance. They're saying that the employer exclusion is disallowing that. So it's kind of almost the same thing with HSAs. It is a tax-deferred benefit, and if you're paying for premiums, you still kind of get those same tax benefits. So it'll be interesting to see how this plays out. But those are some of the things that I'm hearing about coming out from different news outlets. There's also a proposal from Senator Cruz and Mike Lee about allowing insurers to offer any health plans that they want as long as they have at least one ACA compliant health plan to offer. Of course, this is getting a lot of backlash because they feel that this is really setting up separate pools, and ultimately the sick people will pay more, the healthy people will pay less. So, who knows what's going to happen, but I will continue to watch. There is Mitch McConnell did delay their August recess by 3 weeks. They were supposed to start recess on July 31st, and it looks like that has been postponed. So I think, all of us can appreciate that they're working and stopping the bickering, hopefully, and getting something done. What they'll get done is still yet to be seen, but I will be watching. So let's move on. I had a request from, just one more note. The Senate bill, the marked up BCRA, is supposed to be released today. So, again, as soon as I get that information, I'll pass that on to you, but it's not, it hasn't been released yet. So we'll keep watching for that. So I was asked by one of my agent partners if I could discuss a little bit about the PCORI fees. And, the PCORI fees are due to be paid July 31st. So definitely want to kind of go sort of a broad overview of the PCORI fees. They are Patient-Centered Outcomes Research Institute, and what it's supposed to do is help advance evidence-based medicine. They pool, these fees that they pay are supposed to fund this research institute to look for, kind of trends in effective coverage, treatment. Boy, that was difficult to come up with today. So again, I'm not sure what's coming out of it, but it is going to only last until 2019. Who has to pay for it? Well, insurers pay for it if you are a member of a fully insured group health plan, or employers that have self-insured plans or health reimbursement arrangements that they administer. They are subject to the fees as well. So the employers do the self-funded plan or the HRAs, and then if it's fully insured, then the insurance carriers do that. The fee is $2.17 for plans that ended or end January 1st of 16 through September 30th of 16, and $2.26 for the plans that ended 10/1 of 16 through 12/31 of 16. The fees, as I mentioned, if it's for the health plan, it is for covered lives. So if it's a family of 4, that's 4 covered lives, whereas the HRA is a fee per covered employee unit. So if you have one employee with a family, that's one fee for that employee family's unit. Hope that helps. And again, they're due 7/31 and they are filed on Form 720. So certainly if you want more information on this, to reach out to your groups or just for your own information, let me know and I can send you some information. For those of you that are on the HR 360 portal, there is a lot of good information on that portal. So again, reach out to me if you want additional information. 2017 FFM training will be removed from the portal.cms.gov site next week. This is, of course, in preparation for the 2018 certification, whatever that may be. CMS is running some webinars on what is required. What I'm seeing is that it's going to be like last year, where if you've not certified ever before, you have to go through the entire course, or courses, I should say. And if you have certified in the past, in the previous year, then you need a refresher course. So what they did last year was, if they identified you as being one that needed a refresher course for the individual market and the shop market, they would automatically pre-populate that information into your portal so that you would just go in and look at your learning agenda and start with the training. But again, more details will come out. I just wanted to let you know that if you haven't certified by now, it's pretty late, but if you haven't, you still can. Individual BlueEdge Dental is now available in NEPA territory. That's a high mark program, so if you are selling up in NEPA territory, it is available. UPMC announced formulary changes. The details are in my newsletter today. They are reaching out to the affected insureds to let them know about the formulary changes. But again, the information is in my newsletter, so if you are writing UPMC on the group or individual side, or even Medicare, I would definitely take a look at that article in my newsletter. And continuing with training, we are having a lot of training coming up, and August 23rd from 8:30 to 11, I have a seminar here at URL. It's a 2 CE course on the top 10 items to review for healthcare reform compliance. I think all of you within the group health market or a political junkie may want to attend. I think it's going to give you a lot of good information to, of course, continue to act as a resource for your clients, not only a resource for any of the changes, obviously, to the health insurance market, but certainly as far as compliance and keeping your group compliant with everything that they have to do. So if you have some time, please go to our website and register. I'll show you how to do that in a few minutes. I wanted to mention very quickly about the fourth quarter rate. We use Benefix, which, if you are interested in a very affordable group quoting portal that is just going to continue to add services to actually become a full Ben admin system, I would encourage you to reach out to me and learn more about the costs of Benefix. Again, we're not pushing you to purchase these portals, but it is very affordable, and as low as $33 a month. There is a 50% discount for brokers that work with URL. So again, we're not pushing it, but if you have an interest, it might be something that you'd want to take advantage of. But on to fourth quarter quoting, it does look like some of the carriers will be released or have been released will be released next week and the following week. I'm sorry, got my dates mixed up. So if all things go well, we should realistically, by the end of July, the very end of July or beginning of August, be able to quote those fourth quarter rates for you. So certainly timely. And last but not least, I want to remind you not to forget to register for our Medicare Connections and Leaders Conference. Our Medicare Connections Conference is an annual event, and that is taking place September 6th. There are 7 leading carriers that will be there, and the Medicare Connections Conference is really giving you a sneak peek at the Medicare offerings for 2018 for open enrollment. So if you are in that, if you're in the Medicare market or interested in learning more about the Medicare market, I would suggest that you attend the 6th, September 6th. Also in the Leaders Conference, which is September 7th. This is a biannual event, but it is, you know, this year it's in conjunction with the Medicare Connections conference. So again, it's September 7th. And this is really for those that are interested in learning more about or that do business in life markets, annuity solutions, the health markets, disability, and employee benefits as well. The carriers that are going to be represented on the health side are Geisinger, Capital, and Highmark. And of course, Highmark's going to represent all of their regions, North, West, and Central. And what I've asked them to do is kind of give us an update of what they expect to happen with their products and their commissions and their plans for 2018. Again, giving us kind of a sneak peek into 2018, not necessarily product, but you know, just kind of insight into how they're adapting to the law and what they might anticipate if anything gets through the Senate. So again, it's timely and definitely worth the time out of the office. If you are interested in registering, you can go right to our home page, click on Medicare Connections, and the tagline, you can register for Medicare Connections. If you register for the Leaders Conference, it's going to ask you to choose your carrier breakout sessions. So, you know, again, go in and take some time. Hopefully you will register. It's always a great turnout. There's great food. There's great, certainly great correspondence and putting your heads together with other insurance agents that are in the same boat as you are. So that brings us up to the end of the agenda. The next sorry about that. The next webinar is next Thursday, and hopefully we have some questions coming in. So let's see here. I have no questions. My goodness. Well, hopefully you could hear me, and hopefully you found it informative, and that's why you're not asking questions. So again, I just wanted to thank you all for joining in. I'll keep watching the developments and pass those on to you. And as always, I truly appreciate you joining in and the business that you do with URL and your loyalty to URL. I appreciate it, and hope that you all have a great balance of the week and a wonderful weekend. Bye-bye.